Hello, my name is Maria Gabriela and I'm a fourth-year medical student. Currently, I'm doing an undergraduate summer program at King's College London about drug discovery. In this presentation, I'm going to talk about Lonafarnib, sold under the brand name Zokinvy. It is a brand new medication recently approved by the FDA for Hutchinson-Gilford Progeria Syndrome, or shortly, as I may refer to it, progeria. Firstly, it's important to know that Hutchinson-Gilford Progeria Syndrome is different from Huntington's disease. So I'll start talking about progeria and then we'll dive into the drug. Progeria is an ultra-rare autosomal dominant disorder that affects approximately 1 out of 20 million individuals. Until the 30th of June 2024, there were 154 known children and young adults with progeria in 52 different countries around the world. There are still 150 to 250 estimated cases that haven't been found yet. Many things about the disease are still unknown. Unfortunately, if not treated, it is uniformly fatal, and the average age of death is around 14. Children affected by the disease typically die due to myocardial infarction or stroke. Its clinical manifestations are associated with premature aging and mainly involve 4 systems: the cardiovascular, the nervous, the musculoskeletal, and the skin. Its signs and symptoms include failure to thrive, despite adequate caloric intake, atherosclerosis, increased vascular and peripheral calcification, myocardial fibrosis and dysfunction, skeletal dysplasia, decreased bone mineral density, joint contractures, decreased joint range of motion, alopecia, lipoatrophy, and others such as insulin resistance. I know it might be a little bit challenging and even boring to talk about the pathophysiology of the disease, but it is key to understand the mechanism of action of Lonafarnib. A gene that's named LMNA encodes proteins, LMNA and LMNC, that are involved in nuclear integrity and function in the inner nuclear membrane. In normal conditions, the gene's axon produces full-length prelamin A, which undergoes farnesylation, that is a post-translational modification, and other conformational changes until it's matured and unfarnesylated into LMNA protein. In progeria, a single heterozygous cytosine to thymine mutation results in an aberrant prelamin A protein called progerin. Progerin is permanently farnesylated and unable to complete its maturation, leading to its accumulation in the inner nuclear membrane. This process is not well understood, but it happens in progeroid laminopathies like progeria, resulting in all those symptoms I mentioned before. There is a correlation between progerin accumulation and telomere dysfunction, which could explain the premature aging. And also, there's a link between progeria symptoms and DNA damage mediated by inflammatory cytokine release. Now, let's finally talk about our splendid star, Lonafarnib. So, until November 2020, when Lonafarnib was approved by the FDA, the management of progeria was mainly symptomatic and supportive, ensuring optimal nutrition, monitoring the disease progression, and treating complications as they presented. Lonafarnib is the first approved treatment for progeria and other related progeroid laminopathies, diseases that have mutations in the lamin pathway but do not produce progerin. Lonafarnib is a farnesyltransferase inhibitor, an enzyme involved in the post-translational modifications. So remember that I said that the issue with progeria is that this mutation generates an aberrant protein, progerin, that's permanently farnesylated. Then comes Lonafarnib, which reduces the farnesylation of numerous cellular proteins, such as progerin, inhibiting its accumulation. This, in turn, slows the progression of progeria, improves its symptoms, and increases the survival rate, as has been demonstrated in clinical trials. Now, I'll explain the characteristics of the drug. Regarding the ADME, that is, the drug's absorption, distribution, metabolism, and excretion, lonafarnib's oral bioavailability is still unknown. More than 99% of it binds to plasma proteins and is metabolized primarily in the liver by the cytochrome P450 enzymes. CYP3A4 is the main enzyme involved in its metabolism. As a result, medications that are also metabolized by that enzyme cannot be co-administered with lonafarnib, and products with grapefruit must be avoided. As the list of drug interactions is extensive, including medications for diabetes, hypertension, cardiovascular diseases, vitamins, antidepressant, antipyretic, analgesics, and others, if you're taking any medications, please let your doctor know. Lonafarnib's excretion is mainly via feces and it has a minimal urine excretion. Concerning its adverse effects, it can lead to electrolyte abnormalities, increased liver enzymes, AST and ALT, complete blood count alterations, retinal toxicity, nephrotoxicity, and embryo-fetal toxicity. So the patient must undergo regular monitoring for renal and ophthalmological function and birth control methods during the treatment. This drug is indicated in patients 12 months of age or older, and it is administered in oral capsules of either 50 or 75 milligrams twice a day. It's also taken with food to reduce gastrointestinal symptoms, although its absorption might be reduced. I hope you liked learning about Hutchinson-Gilford Progeria Syndrome. Thank you.